Hello, I'm Dr. David Hornbrook, the Clinical Director of Education and Technology here at Keating Dental Arts in Irvine, California. I'm very excited to announce a new kit that we recently developed here at Keating with the DiaShine company on how to polish our all ceramic restorations, whether it's Empress, whether it's lithium disilicate like e.max, or zirconia, both the traditional Bruxers and the Bruxer Aesthetic. Now, the way we designed this kit, it really has everything we need for polishing or adjusting those materials. It comes in a nice box. It has a little card inside, and what I tried to do was really dumb this down for dentists. I'm a dentist and I want things simple. I want my team and my assistants to make it simple. So we put a card in it. First, do not autoclave the bristle brushes because we don't want these damaged. You'll see what that means in a moment. It has really two components. We have our burr block with our polishing instruments, and then we have the diamond polishing paste, which is DiaShine. Now, what's interesting about DiaShine is every ceramist uses DiaShine. There's a lot of manufacturers of different diamond polishing paste. The best is DiaShine. And so we incorporated this into this kit so you can polish either outside the mouth if you're adjusting contacts, or inside the mouth if you're adjusting occlusion. You can polish it back to the same glazed surface that in the laboratory we develop. In fact, the way at Keating, the way we put our final shine on these restorations is we will glaze it to fill up the microporosities, then we go back and polish it with DiaShine. So as we look at this kit, it's in a nice aluminum burr block. It has 5 different polishing instruments. The first is the green, which is a green stone for coarse adjustments. Second would be the blue, and these are rubber silicone dioxide tips. Then purple, and then these boar hair brushes. And again, I try to dummy it down. 1, 2, 3, 4, 5. So we know exactly what order to do this. So let's say our first adjustment would be extraorally. Here I have a Bruxer crown, it's beautiful, but the proximal contact is a little tight, so I need to adjust it. So we're going to go ahead and take our green stone, that's number 1. We're going to put it in a latch type handpiece. Now you may say, what should our RPMs be? Well, again, I try to make it easy. In the kit, do not exceed 10,000 RPMs. The fact that we're using electric handpiece, I can just set it at 10,000. Typically, I use this without water. So once I evaluate where I need the contact adjusted, very little at a time, and this is a heatless greenstone, then we would go and try it in, and let's assume that we like now the new contact. Then we're going to go to number 2, which is the teal colored point. Again, 10,000 RPMs. We're going to adjust that. Then we go to our purple, and I created the purple in a cup so that we can do it on interproximal surfaces as well as occlusal. So with this interproximal surface, I'm just going to use the side of the cup. And then our final polish is I am going to use this wheel. And these are reusable, we just don't want to autoclave them. And then I'm going to take the diamond polishing paste. Again, this is DiaShine. This is also what I have my hygienist use when she does professional cleanings on patients that I've had veneers placed, because it won't damage the restorations and it'll restore the vitality and polish. We don't need very much, just a tiny, tiny bit. We're going to put it on the restoration. Again, 10,000 RPMs. And we have a glazed finish. Easy. And it's just as if the laboratory glazed it and we didn't have to adjust the contacts. Now we would do the same thing on the occlusal as well. Even a porcelain fused to metal crown, this works excellent. So if you try it in, it's a little bit high and you adjust it, you can go through that same sequence, greenstone, teal, purple, and bristle brush with the DiaShine to get a glaze-like finish. Now where it's really great is once we've placed the restorations. Let's say we're working in the anterior. Again, if the contact's tight interproximally, we go through the same steps. Evaluate where the contact is tight. We'll adjust it with the green until it goes down all the way, and then we'll polish it teal, purple, bristle brush with the DiaShine. Let's say our patient, once we get the veneers in, and there's a line angle that's a little bit sharp, or maybe the patient says, I don't like that much facial anatomy. We can actually adjust it in the mouth. So again, I just cemented the restorations. The patient says, you know, that little edge looks bulky, or maybe you look at it and realize that there's a little asymmetry in the corner of the restoration. We take our greenstone, we can adjust that down. Or maybe on the lingual where we had to adjust, it's a little bit high. We go ahead and then go through the teal, the purple, and then the bristle brush. 10,000 RPMs. Very, very easy. And then we follow through with the DiaShine. Now, where this is great is once the restoration is placed in the posterior, especially with our inlays and onlays, and especially with the CEREC users, because we almost always have to adjust those. All right, so once we sat our restoration, let's say we check occlusion and it's a little higher than we would like. And so typically, rather than go right to the greenstone, because the greenstone won't remove a lot, it's very small increments. Usually I'll use a 25 micron finishing diamond with water, and let's say it's a high spot or there's a margin that's a little bulkier than I would like, especially with intrachronal restorations, like our inlays or possibly onlays. We'll adjust that, we'll check it again, looks great. We're going to turn off our water. We're going to go back to our contra angle. We're going to start with number 1. Seems like a good place to start. That's the greenstone. Again, that'll polish the marks off the diamond, from the diamond. Then we'll go through with our teal, our purple, and then our DiaShine. And this is where I like to use this cup brush. It's really a very cool instrument. So what I do is I take a little bit of the diamond polishing paste, I inject it just into the cup brush. You don't need very much. And then we can take it and we can polish that occlusal in approximately, let's say we change the line angle a little bit, and we will get a glaze-like shine. It just rinses off easily. So as you can see, this is a really cool kit. The nice thing too is we provided all the reorder numbers, so as things do wear out, like any diamond or polishing instrument in our practice, you can easily reorder and use the same burr block. We have the phone number for DiaShine right there, so you can order it. Now with this kit, we're offering some specials to our new doctors with their first Bruxer. And that's very cool because the Bruxer or the Bruxer Aesthetic is somewhere in the $99 to $109 range, and you get a kit that is worth about $150. So be sure to give us a call at Keating Dental Arts or check out our website at keatingdentalarts.com.